Hello and welcome. Today we're diving into the world of speech-sound disorder, a neurological condition that affects a person's ability to produce clear and understandable speech. We'll explore what causes it, how it impacts the brain, and the ways we can help those affected communicate more effectively. The causes of speech-sound disorder are varied and often complex. In many cases, the exact cause remains unknown. However, potential contributors can include genetic factors or underlying neurological conditions like cerebral palsy, stroke, or traumatic brain injury. These conditions can disrupt the brain's ability to plan and coordinate the muscle movements required for speech. Sometimes, structural differences in the mouth, such as cleft palate or hearing loss, can also contribute to articulation challenges. The pathophysiology of speech-sound disorder revolves around disruptions in the neural pathways responsible for speech production. The brain relies on intricate networks to translate thoughts into spoken words. These networks involve motor cortex areas responsible for controlling the muscles of the lips, tongue, jaw, and vocal cords. In individuals with speech-sound disorder, there might be impairments in these networks, affecting the precision, timing, and sequencing of muscle movements needed for speech. This can result in distortions, substitutions, omissions, or additions of sounds. The prevalence of speech-sound disorder varies depending on age and diagnostic criteria. It is more common in young children, with studies suggesting that a significant percentage of preschoolers experience some form of speech-sound difficulties. As children develop, many overcome these challenges naturally or with therapy. However, some individuals continue to experience speech-sound disorder into adulthood. The prevalence can also differ across populations and may be influenced by factors such as socioeconomic status and access to speech-language therapy services. The signs and symptoms of speech-sound disorder can manifest in a variety of ways. A primary symptom is difficulty producing speech sounds correctly, leading to mispronunciation of words. This might involve substituting one sound for another, distorting sounds, omitting sounds altogether, or adding extra sounds. Speech may sound slurred, imprecise, or difficult to understand. The impact of these difficulties can range from mild frustration to significant communication challenges, affecting self-esteem, social interactions, and academic performance. It is important to remember that some errors are expected for developing children. Diagnosis of speech-sound disorder typically involves a comprehensive evaluation by a speech-language pathologist. This assessment may include a thorough review of the individual's medical history, a detailed articulation test to assess the production of individual sounds, and an examination of speech intelligibility. The speech-language pathologist will also assess oral motor skills, such as the strength and coordination of the articulators. In some cases, additional evaluations, such as hearing tests or neurological exams, may be necessary to rule out other potential causes. Speech-sound disorders can be categorized in different ways, reflecting the underlying causes and characteristics of the disorder. Two broad categories are articulation disorder and phonological disorder. Articulation disorder involves difficulty producing specific speech sounds due to motor difficulties. Phonological disorder, on the other hand, involves difficulty understanding and applying the rules that govern how sounds are used in language. Some individuals may also experience childhood apraxia of speech, a motor speech disorder that affects the ability to plan and sequence the movements needed for speech. Treatment and management of speech-sound disorder typically involve speech-language therapy. Speech-language therapists work with individuals to improve their speech-sound production through a variety of techniques. These may include exercises to strengthen oral motor skills, articulation drills to practice producing specific sounds correctly, and phonological awareness activities to improve understanding of sound patterns in language. The specific approach used will depend on the individual's needs and the type of speech-sound disorder they have. Early intervention is crucial for maximizing positive outcomes. While it's not always possible to prevent speech-sound disorder, there are steps that can be taken to reduce the risk. Ensuring proper prenatal care and avoiding exposure to toxins during pregnancy can help support healthy brain development. Early identification and treatment of hearing loss can also be beneficial. Additionally, providing children with a stimulating language environment and encouraging communication can promote speech development. For those at risk due to genetic factors, genetic counseling can provide guidance and support. The prognosis for speech-sound disorder varies depending on the severity of the disorder and the individual's response to treatment. With early intervention and consistent therapy, many children are able to overcome their speech difficulties and achieve clear and intelligible speech. However, some individuals may continue to experience residual challenges into adulthood. Recent research is focused on developing more effective diagnostic tools and treatment approaches for speech-sound disorder. This includes exploring the use of technology, such as computer-based therapy programs, to enhance treatment outcomes.